First, we get started today with our sit-down interview with the Boston University Dean of the School of Public Health, Sandro Galea, here to talk a little bit more how health data will be used in decision-making when it comes to public health. Thanks for your time this morning.
Thank you for having me.
First, let's start off with defining exactly what we mean when we talk about health data.
When we think about health data historically, we have thought about things like electronic health records, data about your doctor's appointment, data about your blood pressure, and about your cholesterol when you see your doctor. But as we recognize that health is produced not just by medicine, health is produced by the world around us. This is SPH. It's all about understanding that health is produced by the air we breathe, the water we drink, the food we eat, our jobs, our environment. One realizes that we need data on those forces as well in order to understand health. So what we have been trying to do is to push the conversation and to say, if there are these determinants of health that we've called historically the social determinants of health, that we need data about those determinants to also inform how we understand health.
Okay, and so to that point, there has been a 3D commission that has put together a report. This is a joint effort between Boston University and the Rockefeller Foundation.
Correct.
Let's talk about that.
Yeah, so the commission is called 3D because it's data, determinants, and decision making. So the idea was, how do we think about collecting data from these multiple sources to the end of understanding the full set of forces that generate health so that we can make better decisions, so that policymakers can make decisions that actually improve health. Now that's actually quite a shift from how we typically have done this, because really it has been data about health outcomes that have fed into policy, meaning percent of people with diabetes, percent of people who have heart attacks, prevalence of cancer. So really we have used data strictly from the place of the health outcome, so measuring health. That still remains important. And now what we're saying is we should extend our lens on data to understand what drives health. And in doing so, we can make decisions about how to optimize what drives health to keep people healthy.
And so the 3D Commission has published a report about a year ago about their findings. Are there any key aspects from that report that you'd like to highlight?
Yeah, the 3D Commission came up with a set of principles and a set of recommendations. So number one is we need to move beyond thinking about data as a single narrow stream, the data that's collected when I go to my doctor's office, to collecting data about the world around us. That's number one. Number two is once you do that, you need a system of accountability to that data and a system of transparency about how that data then goes on to introduce decisions that shape policy. So it really elevates our game of engagement with that and feeding that in a way that is translatable and understandable to those who are in a position to make decisions that shape the population's health. So it is a much more dynamic and engaged view of collecting data about everything that shapes our health and a system of putting responsibility on all of us to act on those data to create better health.
When you're talking about, an environmental, taking environmental data and applying it to someone's health, you're talking about not only looking at my blood pressure, my cholesterol levels, but also taking into account what might be in the water that I'm drinking.
Well, that's correct. I think what might be in the water, but also things like minimum wages. So for example, data about minimum wage and the extent to which different minimum wages are associated with people's health. That should be part of the conversation when there are conversations about setting minimum wages. Data about types of cities and building codes and different urban planning, and how does that influence decisions that are made about building in cities and what are the implications of that for health. Data about any range of forces in the world around us. So yes, water quality, air quality from the point of view of climate and all that. So really it's saying that if we know there is no health without a healthy world, well then we should be measuring the elements that make that world healthy so that we can actually move us in that direction.
Fascinating. All right, how do you think that the growth and maturity of data science will help our understanding of social determinants in the future?
Yeah, I feel quite optimistic about this, in that there is, as you correctly say, there is an explosion of interest in data science. And population health science is about collecting the data and analyzing it to the end of understanding what generates health and what generates health equity. And we haven't talked much about health equity, so just to put it in a conversation, that what we're doing is not simply improving health, but also narrowing health gaps. It is not good enough to simply say we're going to improve health on aggregate if some people are health left behind. We are beginning to recognize that having big data with large volume that we collect quickly to inform our understanding of the world around us is becoming much more commonplace, and we're getting better and better at learning what to do with that. And all of those data should be then informing the decisions we make to optimize our environment.
Fascinating. All right. Well, thank you so much for your time this morning. Thanks for breaking it down for the layman like me. Certainly appreciate it.
Thank you for having me.